The skin derivatives are the sudoriferous glands or the sweat glands, the sebaceous glands or the oil glands, the hair, and the nails. Hair is dead keratinized cells made with a very hard keratin that's more durable than the soft keratin found in the skin. You do not have hair in the palms of your hands, the soles of your feet, on your lips, on your nipples, or on portions of the external genitalia. Skin has several functions. It helps warn you of insects on your body. As they land on your hair, they tend to trigger a little bit of a nervous sensation that lets you know that hair has been bent slightly. It will help protect you from physical trauma, particularly the hair on your head, which is rather thick. It also helps prevent heat loss. Again, this is more a function of the hair on your head. And it will protect you from sunlight. The hair follicle has the hair matrix cells. They're here in the very base of the hair follicle, and just like the stratum basale, these are the actively dividing cells of the hair. The papilla is this nipple-like projection that has the blood vessels in it. This is what's going to nourish these rapidly dividing cells. There's also a little root hair plexus, a little group of nerves that lets you know that your hair is being bent or pulled out. Hair pigments rely on melanins, yellow, rust, brown, black, and pheomelanin, which is found in red hair. When we have gray or white hair, it's because of decreased melanin production or increased air bubbles in the hair shaft. Hirsutism is the word used when someone has excessive hair. This is typically genetic and people just have more hair than other people. Alopecia is the word for baldness, and there are several things that lead to hair loss. Some of the causes of hair thinning can be things like an acutely high fever. That high fever may damage the hair follicles and make your hair fall out. Surgery may do it. Severe emotional trauma. Certain drugs can affect the hair follicles. Things like antidepressants, blood thinners, steroids, and chemotherapeutic drugs damage the hair follicles, and so they fall out. Because hair is protein in nature, if you're on a protein deficient diet, you may not replace hair as rapidly as you should. Alopecia areata is an immune system disorder. Here the immune system attacks the hair follicles, destroying them, and they don't come back. Some hair loss is reversible. For example, some of your drug hair loss, if you stop taking the drugs, the hair comes back. But others are permanent. Your nails are scale-like modifications of the epidermis. They help protect the ends of your fingers and toes, and they can even act a little bit like tools. You scrape with them, you turn things with them. They contain hard keratin as well. They're pink because of the capillaries of the dermis that are under the nail. So here you see the nail. This is a side view. Rapidly dividing cells are back here in the nail matrix, protected here. The cuticle helps prevent bacteria from getting into this area of the nail. And this will be the body of the nail. This is dead keratinized cells. Here is the free edge of your nail. You do have that little white lunule that simply shows there at your nail bed. Your sudoriferous glands are your sweat glands. We have up to 3 million per person. They're found everywhere except the nipples and parts of the external genitalia. There are 4 types of sudoriferous glands. We have the eccrine glands or the merocrine glands, the apocrine glands, ceruminous glands, and mammary glands. Ceruminous and mammary glands are modified sweat glands. The eccrine glands are the most numerous. They're found particularly on your palms, on the bottoms of your feet, and on your forehead. These glands are coiled tubular glands. They secrete through a pore on the surface of your skin. The sweat they produce is mostly water. It is a means of excreting a little bit of salt, vitamin C, some antibodies, some metabolic waste, and some lactic acid, but it's primarily water. The purpose of this sweat is thermoregulation. As you get hot, you sweat. The sweat evaporates, that cools you down. Your sympathetic nervous system is in charge in the secretion made by these glands. So here you see a sweat gland, an eccrine gland, because its tube goes all the way here to the top, to the sweat pores. And this is cross-section across those tubules. You will see simple cuboidal epithelium makes up the lining of those tubules. The apocrine glands are found in the axillary and anogenital areas. These ducts typically empty into hair follicles. Now they produce a viscous, milky sweat. It's got some fatty substances in it and some proteins. Bacteria break down this kind of sweat, and that's what leads to body odor. Again, these glands are controlled by the sympathetic nervous system, which tends to kick in when there's pain or stress. These glands are not activated until puberty. They may be analogous to musk glands of other animals, that is, those scent glands that help animals find each other. The modified glands include the ceruminous glands. These are modified apocrine glands that secrete cerumen or earwax. These are found in the external ear canal. This material helps block insects and other foreign material from getting to your eardrum. It also may act as a little bit of acoustical tiling. When you're exposed to very loud noises, you tend to make more earwax. And then mammary glands are also specialized sweat glands, but they secrete milk. Sebaceous glands secrete sebum or oil. This is necessary to keep that dead keratinized hair and skin soft and pliable. It also helps prevent water loss. Sebum contains some bactericidal substances that help kill bacteria. This doesn't mean your skin is bacteria-free, but it helps keep the number of bacteria to a more acceptable level. We find oil glands everywhere except the palms of the hands and the soles of the feet, areas that typically get very dry. Oil gland openings tend to be larger on the face, neck, and upper chest, which sometimes leads to those large pores. Usually, sebaceous glands secrete into the hair follicles. They are stimulated by hormones, particularly the male hormones, the androgens, at puberty. Here you see a sebaceous gland, and notice how it empties directly into the hair follicle. Here it is here. Whiteheads are a pore clogged with sebum. Blackheads are a similar thing, but here the sebum is oxidized and makes it look black, so it dries out somewhat. In acne, the oil glands become inflamed. Bacteria invade the area and start to grow in the oil glands. And seborrhea is when you have overactive oil glands. You sometimes see this in infants as cradle cap. Here, because there is so much oil, the epidermis doesn't shed like it should, and you get that epidermis hanging around and it gets packed down with oil. The skin has several functions. Obviously, its primary function is protection. It acts as a chemical barrier. We have antibacterial and antimicrobial secretions in oil and sweat. We have a slightly acid pH on the surface of the skin. And then melanin helps protect our DNA from ultraviolet light. It also acts as a physical barrier. It's waterproof. And finally, it's a biological barrier. The macrophages and the Langerhans cells that migrate around under the skin help protect us from invading organisms. The skin also functions in body temperature regulation. Sweating helps us cool down, and because of all of those capillaries in the dermis, they can open up when we're warm. We get very pink because we're trying to let heat radiate away from us, or they can close down when we're cold and send blood deeper into the body. And it also provides us with cutaneous sensation. Meissner's corpuscles and Merkel cells help us with light touch. Pacinian receptors are deeper in the dermis, and they are prone to more deep pressure. And then we have bare nerve endings in the dermis that are our pain receptors. Skin also has a metabolic function. It helps produce our vitamin D. Vitamin D is necessary for us to metabolize calcium appropriately. Our skin can break down certain carcinogens that we come in contact with and converts cortisone to hydrocortisone, its active form. It even produces its own anti-wrinkle substance. It produces an enzyme called collagenase. The skin acts as a blood reservoir. About 5% of our blood can be in our dermis. If we need it elsewhere, we can shunt it to other more vital parts of the body. And finally, it's involved in excretion. Remember, there are some substances in sweat, some of those nitrogen-containing wastes, that are minorly excreted through the skin. Skin cancer is one of the disorders of the skin. Most skin tumors are benign and do not metastasize, but some are malignant. Some of the risk factors for skin cancer include overexposure to ultraviolet radiation and frequent irritation of the skin in the same spot. Some skin lotions contain enzymes that can repair damaged DNA. There are three major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the least malignant and most common, accounting for about 80% of all skin cancers. The stratum basale cells, which are still actively dividing, invade the dermis and hypodermis. As a result, we get a shiny dome-shaped nodule on the surface of the skin. This tends to be slow growing and seen in areas of sun exposure, so usually areas where you're going to notice them. This type of cancer rarely metastasizes and is typically cured by surgical excision of the lesion. 99% of cases are taken care of this way. So here are some basal cell carcinomas. There. Here's one. This is a non-pigmented mole. There's one, and there's one. Pretty obvious that they look different. Squamous cell carcinoma is the second most common skin cancer. This arises from the stratum spinosum cells. These cells are still capable of cell division, and so they can have things go wrong there. Here you tend to see a scaly, reddened papule that tends to form an ulcer. This is often seen on the scalp, the backs of the hands, the tops of the ears, and the lower lip. They do grow rapidly, and they have a higher incidence of metastasis. There is a good prognosis if this is treated early by radiation therapy or removed surgically. So here you see a squamous cell carcinoma, a basal cell carcinoma. There's a basal cell carcinoma on the eyelid, one on the nose. This is one on the lip. Malignant melanoma is highly metastatic, and it does resist chemotherapy. It arises from melanocytes anywhere on your body. Mostly we see it associated with moles. It's fairly rare, only 5% of our skin cancers, but in recent years has been increasing. It's now up to about 8%. Pigmented spots with various black or brown color are one of the things you look for with melanoma. When you examine pigmented spots, you can use the ABCDE rule. This is treated by wide surgical excision. They take a lot of tissue out when they're taking out a melanoma because of the possibility of metastasis. Usually you also have chemotherapy. Here you see melanomas. Notice how they're dark discolorations. And here's one inside the roof of the mouth, so you need to look everywhere. The ABCDE rule for examining pigmented areas is asymmetry. The sides don't match. Border irregularity. Instead of having a smooth border, there are indentations or wavy lines. Instead of being a single brown color, you see multiple colors, varying shades of brown, sometimes even red or blue spots. The diameter should be not larger than 6 millimeters. That's the size of a pencil eraser. And you look for an evolving spot, something that's changing rather suddenly or rather rapidly. Another homeostatic imbalance is burns. Burns is damage from intense heat, radiation, electricity, or chemicals. Burns can be life-threatening because of the chance for circulatory shock. As a result of losing our waterproof barrier, we lose lots of body fluids. Dehydration can occur, and that can lead to electrolyte imbalance. There's a loss of proteins, so we can't repair tissue very well. And there's the loss of the infection barrier. The immune system is depressed, and you're much more likely to get an infection. The rule of nines can be used to estimate the extent of the burn. It also can be used to calculate fluid loss. It takes into account that there are 11 body planes, each of which accounts for about 9% of the body. The last 1% is the genital region. The front of the head, the back of the head. Front of the head's 4.5%, the back is 4.5%, so the head is 9%. Then the front and back of each arm is 9%. Then the front of the trunk is 18%, the back would be 18%. 9% on the front of each leg, 9% on the back of each leg, so 36% here. That's how they estimate how much of the body is burned. Burn severity depends upon how many layers of the skin are damaged. In a superficial burn or a first-degree burn, only the epidermis is damaged. Here you see redness, maybe some swelling, and there will be pain. A pretty simple sunburn is a first-degree burn. In a partial thickness burn, you have a second-degree burn. Here you've damaged the epidermis and the upper part of the dermis. This will cause the epidermis and the dermis to separate, and fluid will collect there, so you're going to have blistering. In a full thickness burn or a third-degree burn, the entire thickness is damaged. The area will appear gray or white, cherry red, or blackened. Because you will have destroyed the nerve endings, there is no pain associated with a third-degree burn, but the area will be surrounded by partial and superficial burn areas, and those will hurt. Skin grafting is usually necessary to recover from this type of burn. Burns are critical if more than 25% of the body has partial thickness burns, second-degree burns, or if more than 10% of the body has full thickness burns or third-degree burns. There's also a great deal of concern if the burns are on the hands, the face, or the feet, because those areas will have a direct route for the heat to have gotten into the respiratory system. If you fry your lung tissue, you are not going to survive. We can't replace that lung tissue fast enough, and your lungs will fill up with fluid. Treatment of burns will include debridement, or removal of the burned skin, lots of antibiotics to help keep infection down, some sort of temporary covering to allow the skin to try to repair, and if there's a sufficient area damaged, skin grafting. As we age, in infants and children, we see the skin thicken and the sweat glands activated. In adolescence, the sebaceous glands kick into high gear and the apocrine glands are activated. In adults, our best appearance of the skin is in our 20s and 30s because after that time, environmental assaults accumulate and we start having other problems with our skin. In older adults, our epidermal cell replacement slows, so the skin thins. We're more likely to have bruises. Sebaceous gland activity will decrease, so there's a higher incidence of dry skin. The fat layer will diminish in the hypodermis. Older people frequently complain of being cold. Elastic and collagen fibers are not replaced as fast as they're destroyed, so they decrease in number. This leads to wrinkles. And finally, hair follicles are less active, melanocytes are less active, so hair tends to thin because of aging, and hair tends to turn gray.